Hello, this is JC Johnson. My goal for this presentation is to go over what I have learned in this class and let that ultimately lead to what I have planned in order to do my best to become an asset in my future organization, God willing. What I learned about common mistakes from week 1 involved the fact that communication is key in reducing common mistakes in the medical field. It is expressed in Montebello's research on the meaning and role of organizational advocacy, the fact that open communication is a huge factor in customer or patient advocacy. I specifically tuned in to the common error in regard to wrongly medicating patients, and this is very much due to either incorrectly recording the medications and/or treatment plan. I recognize that there is a great need in bringing clarity to the provider and the consumer in his or her treatment plan. Taking seriously your role as a medical provider is an effective effort in resolving this problem, for example, by realizing how important doing your job actually is and not seeing it as a mundane thing. From recording to administering the medication, communicating well with the patients is necessary, and just by taking more pride in your job and putting in more effort. If there's professional accountability, for example, and being willing to admit that you are having a bad day, being honest, being willing to learn, listening to others' advice, and to seek clarification when needed, there will be more accountability with a double-checking system. Even just caring for other fellow employees and recognizing that they need help in any area and taking some of the burden off of their shoulders, errors will be reduced. What I learned about myself from week 2 involves me recognizing that I'm not where I want to be. I recognize how much growth needs to take place. I also know that so much of growth comes with being willing to put in the effort. It is not easy to do so, and it is so much easier to go throughout my day just trying to get through. But I've begun to imagine what I could learn in the span of a single day. I also realize that I'm not going to be perfect. And instead of getting frustrated with myself, I need to give myself grace. I found it hard to recognize my faults and be able to admit to them. I also sometimes struggle with self-confidence because I never achieve whatever it is that I set before myself to achieve. This just leads to a failure mindset and makes me focus on where I'm lacking rather than where I'm growing or helping those around me. I found that my strengths tend to revolve around work ethic, soft skills such as showing empathy, caring for those around me, and being an approachable person. I learned that I will need to be aware of possibly being too emotionally attached to my patients, which could lead to burnout really quick if I'm not careful. Emotional contagion, as Petita found in her research on how emotional contagion relates to burnout, explained that it is easy after experiencing negative emotions from fellow coworkers or with your patients, for example, to then have these negative emotions be taken upon yourself, causing feeling of burnout and or insecurity within your job, and it is important for me to recognize that these emotions and not allow them to control me. What I learned in the scenario of week 3 involves gray areas and how difficult it can be to make correct decisions. It can be tempting to turn a blind eye in some situations, but to uphold one's true integrity, you must always stand up for what is right. You cannot control how others view you when you call yourself out for a mistake, but you can control how you will personally respond to that mistake. If I'm not careful, it is so easy to let slight errors slip on by, but I have to come to realize that it is not worth it in the end if that is how I'm going to live my life. Because by ignoring the little mistakes, they will compile into a huge mess over time. I recognize how important accountability is and how it needs to be placed into one's organization's culture in order to fully see it through to completion. I recognize how easily fallible the healthcare system is and how often problems slip by without anyone making a change. I recognize the need for incentives and to get people to act in an ethical and honest behavior. It may be what organizations need in order to produce change in this area of accountability and ultimately being a safer environment. When it comes to what insights I gained from the interview in week 4, I gained insight into the life of Kayla Hamilton, an occupational therapist. I found it extremely interesting in regard to discussing mistakes that she had experienced within her field. She said that there is much frustration found in regard to communication between specialized personnel within the hospital setting. This comes from the past documentation not being correctly communicated. She explained the fact that often she would put a ton of effort into making sure she fully understood the patients and their history prior to seeing that patient, then would continually be frustrated when later she would find out that there was vital information missing. She also gave me insight into needing to understand that whatever field I go into, I should be careful to diagnose and treat within the boundaries of my field, even if I'm tempted to stray from it. She expressed this because it will reduce frustration from one professional to another in order to be an expert in your field, creating less conflict, and they will not be as nosy and prideful in regard to other people's specialties. My plan to make myself an asset in my medical organization involves remaining on top of current research within my field, continually learning in order to do my job to the best of my ability. I will try to be always willing to learn. As Vahid expressed in his peer-reviewed journal on medical teaching and learning, growth versus fixed mindset in medical education, those who have growth mindset will through learning continually go back and evaluate what they know and find a way to fully maximize and reach their ultimate potential. And this is what it takes in their medical field to do your best. I will always recognize that I am not perfect, and I may be making mistakes even if I do not realize it. I will also try my best to remain humble in sticking to my specialty and not poking my nose where it does not belong. My goal is to be a light to those around me in my field, living a life in which people can ask why I am the way that I am. Ultimately, to be able to share the gospel and care for my fellow co-workers and patients as they should be cared for. In conclusion, throughout this class in medical terminology and the many various things that I have learned, I had no idea what I was getting myself into with this class, but I'm pleasantly surprised with my experience, and I'm thankful for the many new ideas that I have in order to go forward in my career and get to my full potential in my field. Hopefully, ultimately, being an asset in my organization, the sky is the limit. It just involves taking steps in the direction that God is leading me. Thank you.